Good afternoon, Miss. I am Arsen Vine M. Caban from BSN2 Weidenbach, and today I am going to perform nasogastric tube feeding. So, what is nasogastric tube feeding? Nasogastric tube feeding is the installation of specially prepared nutrients into the stomach through a nasogastric tube. Objectives: to provide alternate means of ingesting nutrients for patients with functional gastrointestinal tract, to intervene in pre-existing or impending nutritional depletion from debilitation, to provide aggressive management for certain disease conditions such as anorexia, to provide means of nutrition if there is an inability to swallow or an existing obstruction in upper alimentary canal, to provide nutrients for patients in comatose or semi-conscious state, to provide increased nutrient requirements above oral consumptions, to provide nutrients for post-operative patients with bowel sounds present, and to maintain fluid and electrolyte balance.
Good
Explain the
afternoon sa
procedure.
mga listeners by Malusubong Adlaw, mag-perform kasi mo sa Mr. Gastric feeding. Muna siya ang hatag kasi mo pagkawang to Mr. Gastric tube.
Perform hand hygiene. Prepare feeding container to administer formula. Have tube feeding at room temperature. Shake formula container well. Place client in high Fowler's position or elevate head of bed 30 degrees. Aspirate gastric contents to check for gastric residual. Measure pH of aspirated gastrointestinal contents. Observe the aspirate's appearance. Consider the results from pH testing and the aspirate's appearance together. Initiate feeding, bolus or intermittent feeding. Pinch proximal end of the feeding tube. Remove plunger from syringe and attach barrel of syringe to end of tube. Fill syringe with measured amount of formula. Release tube and hold syringe high enough to allow it to empty gradually by gravity. If feeding bag is used, hang feeding bag on an IV pole. When tube feedings are not being administered, cap or clamp the proximal end of the feeding tube. Administer water via feeding tube as ordered with diluted formula. Rinse bag and tubing with warm water whenever feedings are interrupted. Measure amount of aspirate every 4 hours. Monitor finger stick blood glucose every 6 hours until maximum administration rate is reached and maintained for 24 hours. Monitor intake and output every 24 hours. Weigh client daily until maximum administration rate is reached and maintained for 24 hours. Then weigh client 3 times per week. Observe the return of normal laboratory values. Evaluation. Patient tolerates feeding well and weight is maintained or increased. Appropriate residual is obtained from aspiration of stomach contents. Patient complies with feeding procedure. Intake and output balance is maintained. Nasogastric tube functions efficiently and remains patent.